inyectar para dormir. Cuando me iban a entubar.
We've really seen this across the country during this epidemic.
We are seeing a surge in cases amongst our Latinx residents.
Here in New York City, just devastating numbers for the Latino community as well.
Why is it that the poorest people always pay the highest price?
That's a blatant inequality, and we don't accept it.
This is the mission, the heart of San Francisco's Latino community. 25% of positive COVID-19 cases are among Latinos, although they make up only 15% of the San Francisco population.
Nosotros los latinos somos los que estamos en esto sufriendo más.
We do the worst job or the more difficult job in this country. The low position is who affecting the most, and especially in this situation.
I know people, they haven't got a check in the last month and a half. So it's kind of tough, you know what I'm saying?
Muy desesperantemente todo eso.
I know these are trying times. We're trying to stay home, we're trying to be safe, we're trying to stay active, but in order to survive this thing, we have to stay at home, and we've got to be diligent about that.
We appreciate you, we see you, and you count.
ABC 7 presents Race and Coronavirus, a Bay Area conversation.
Good afternoon, and thanks for joining us for this special edition of ABC 7 News. I'm Larry Beal, along with Leanne Melendez and Luz Pena. Instead of our usual 4 o'clock newscast this afternoon, we're going to spend an entire hour engaging experts and you're an important part of this, in an ABC 7 Listens virtual town hall on the issue of race and coronavirus.
This is an important 1-hour virtual town hall airing on TV, on abc7news.com, YouTube, and Facebook. And today we're taking a closer look at the Latino community.
Over the next hour, we'll have a frank conversation with a panel of experts and questions from you watching us.
Well, of course, the Latino community is now the group with most cases of coronavirus in California. In fact, nearly 65% of all COVID-19 deaths have been among those 18 and 49 years old. We're here to figure out why they are so disproportionately affected. I spent a few days in the predominantly Hispanic Mission District, and it wasn't hard to come up with answers.
Even in moments of despair, San Francisco's Mission District maintains a zest for life and prosperity. Latinos, a majority here, are known for their family cohesiveness, a cultural trait that in times of the coronavirus has worked against them.
As somebody who is a member of the Latino community, I'm well aware that many of our folks live in mixed status households or multi-generational households. And so sheltering in place, self-isolation, quarantine, these are things that are very difficult.
Alexis Terrazas is the editor of the local newspaper El Tecolote, reaching out to a community craving for more information on the virus. But ask anyone here, and they will also blame the high cost of housing in the neighborhood for the overcrowding. Families living together is the only way to stay in the mission. It's not hard to find someone who has been impacted by the virus. A casual conversation with this mother revealed her husband spent months in the hospital with the virus. He fell after feeling dizzy. The virus is an ugly disease. We prayed for him and our prayers saved him, she tells me. Another factor for the increased infection rates is that many Latinos work essential jobs.
It's our frontline workers, our folks that are in the food and beverage industry, our folks in the janitorial industry, our folks in the trades. All are exposing themselves to the virus by being out.
Proof of that is in the number of Latinos hospitalized. Take San Francisco General Hospital.
Whether we look at outpatient testing, whether we look at who's hospitalized here, and over 80% of folks are Latino, or whether we look at the study results from the mission. And so what we're seeing is really a disproportionate impact on the Latino community.
The recent testing done in the mission by UCSF found that of the more than 3,000 people tested, 2% showed they were positive for COVID-19.
While 2% seems low, it's a little bit higher than I would expect after, many weeks of shelter in place, and it would have been nice to see that lower.
Of the people who tested positive, 95% were Latinos. Latinos are also more likely to die from complications associated with COVID-19. That's because of pre-existing conditions. A UCLA study found that more than 19% of Latino adults over 50 reported having diabetes, nearly twice the number of white patients. Governor Gavin Newsom recently announced $125 million in disaster relief to the state's undocumented workers. In San Francisco, advocates say more financial help is needed locally.
What can we as a city do to help ease those fears and ensure that people feel comfortable in knowing if they test positive, they will be taken care of?
And because there have been so many shutdowns, we know that Hispanics are almost twice as likely as whites to lose their jobs. And we're going to talk a little bit more about that, Larry.
So you spent several days in the mission working on this story and talking with so many people. What else did you learn beyond the numbers, which are staggering and devastating?
Well, you know, first of all, something that I've always known about the people in the mission is that they're very welcoming. There is a true sense of community, right? So social distancing has been very, very hard for them. Also, you know, for many staying at home, it's not an option. They don't have that privilege. You know, many Latinos in the mission need to work. They are very proud and hardworking people. Now, listen to this. Not having a job, and I'm going to say this, not having a job is perhaps just as scary as getting the virus. But this is the reality. You know, Latinos make up 16% of the population in San Francisco, but you heard in that report that more than 80% of the patients with COVID-19 at San Francisco General Hospital are Latino. And we're here to talk more about that contributing factor that has led to that.
It's such a huge disparity. We have so much to discuss with our live panel today. We put together a really insightful group. I think you'll enjoy listening to everybody and hearing what they have to say. Zooming in, we have David Campos, a Santa Clara County Deputy Executive, along with Congressman Joaquin Castro, Congressional Hispanic Caucus Chair.
We also have Dr. Sandra Hernandez, CEO and President of the California Healthcare Foundation, and Jacqueline Martinez-Garcel, CEO of the Latino Community Foundation. And I want to start with you, Jacqueline, because there is a lot of distrust among Hispanics. We know that it happens in the Asian American communities. It also happens among African Americans. There's also the language factor. Are we doing enough to reach out to members of our community, the Latinos? And also, what would you do? What would be the first thing that you did to improve things?
Well, Leanne and Larry, first of all, thank you for hosting this conversation, and for Luz Peña. I have to say this before we get started on those questions. I want to acknowledge that the collective trauma and the universal vulnerability that we're all feeling right now is real. This virus, no one is immune to it, by race, age, where you live. But what this public health crisis has unveiled for all of us, again, are the dark and deep and persistent inequities that exist in our communities and in our families. It's important that those are the viewers right now are watching this and understand that before this virus hit, 1 out of 4 Latinos was living with diabetes. 1 out of 4 was diagnosed with asthma. 1 out of 2 Latino men had hypertension. You look down the list of all chronic conditions, and over time, again and again, we see the numbers persistently higher in Latino and Black communities. And this virus, just like past viruses, HIV/AIDS, they follow a structure that we've created with the policies that we've put in place that have allowed people to live in segregated neighborhoods with poor access to healthcare, with hospitals that are under-resourced and health centers that are under-resourced, in places where people don't have healthy places to eat, exercise, to live, to even breathe in certain circumstances. So what's so important is that while we're all experiencing the vulnerability of this virus, Latino, Black communities are being hit hardest because there are structural paths that we've created through our policies that made it possible for this to unleash so much pain. And it's quite personal. Leanne and Larry, I want to share that in the first 3 weeks of March, 5 of my cousins were diagnosed positive. In the weekend of April 19th, I received 3 back-to-back calls of members that had not made it. Their battle was lost. And so Your question, there's a lot to unpack there. We have to think about the immediate response that's happening and the tracing that needs to happen in our communities. But what we really need to focus on simultaneously is how do we address the inequitable policies and neighborhood problems that have existed before this virus has hit us.
Could I just interrupt you to ask you, what specifically are you doing to reach out to those communities?
So the Latino Community Foundation is a statewide foundation. The first thing we did on March 16th, the day before we even issued a statewide mandate, was set up a Love Not Fear Fund. And we did it because we knew that the federal government was not going to be responsive to undocumented workers who were going to be losing their jobs, or that vulnerable seniors living in the Inland Empire weren't going to have the support or the infrastructure in place that they needed to get the food or the resources that they needed. So we set up a fund to immediately provide dollars in the hands of organizations that can actually drive over, take the food there, provide financial aid for families that were already seeing cuts in their wages. But right now, we're also focused on the long-term policies that we need to see happen. And even right before this call, 70+ Latinos were on a call with the governor to talk about the fact that even though California is going to face a $54 billion budget, we cannot afford to allow California to cut the programs that have been the safety net of our community, and more importantly, be proactive in setting a social contract for our Latino communities.
Let me go on to ask Dr. Sandra Hernandez, President and CEO of the California Healthcare Foundation. You know a lot about healthcare among the Latino population in the Bay Area. You've been around for a while. You were also working at San Francisco General Hospital. Does it make sense to you, this disparity, 16% in San Francisco versus 80% of the patients that we have with COVID-19 at San Francisco General?
Yeah, I mean, it's not surprising. Everything that Jacqueline said is true. I do think that it's not surprising that you have a virus, first of all, that is so virulent and so contagious. And you're in a situation where you have a community. If you look at the people that were hospitalized and even look at the people who tested positive in this mission-based testing, most of them are men who are working age men. And that's because they're out working in the very jobs that are essential. They are as essential as our nurses and our physicians and all the people in hospitals who are stepping up in a very unprecedented time and unprecedented way. I mean, one fact just to pay attention to about the statement of our healthcare system in this country. We spend almost 18% of our GDP on healthcare. And when an epidemic happens like this, we don't have enough protection for our basic healthcare workers or for the people who put food on our table and cultivate the food from the land. That is an extraordinary statement about how misaligned our policies and priorities are as a country. And so what this disruption does, it does make people make decisions. Not that I don't want to stay home and be isolated and care for my family, because that is not actually the options that so many people living and working in the mission and Latino communities all across the state simply don't have that option. They need to work. And in fact, if they weren't working, we wouldn't be eating. And so essential has been redefined. And I think the virus, very importantly, has disrupted many of the policies that Jacqueline's talking about. And it's certainly true in healthcare. If for so long we've been talking about telemedicine and telehealth and how to reach people in culturally competent ways, and you get an epidemic and suddenly people say, we should be doing that. And yes, in fact, we should be doing that. And so I think the question that we are faced with now is how do we reconstruct our healthcare system to value public health, to value prevention, and to really invest in community-based interventions that will reduce the kind of comorbidities that make the Latino community so at risk for viruses like this and for other things that will come down the road, climate change, et cetera.
Great. So we have much more ahead. I want to talk about hazard pay as well, now including messages from community leaders, celebrities, and influencers direct to you.
And we want you to join in this conversation. You're a part of this. ABC 7 Listens Town Hall as well. Go to Facebook or YouTube to weigh in, and you can interact in today's virtual town hall.
The Unity Council stands with you and is here to help you get back on your feet so that you could work, learn, and thrive. We appreciate you, we see you, and you count. The unsung heroes of our economy, the 5th largest in the world, are Latinos. Latinos are keeping the economy moving, even in shelter in place. We have built this economy, and we will bring it back. But we cannot return to the way things were. Together, we will build a new economy that works for us all.
All right, so we continue the conversation online, and I just want to go back. I should mention, first of all, both to David and Joaquin, we'll be getting to you in the next segment. Once these things get rolling here, everybody has a lot of points to make, and so I appreciate your patience here. But I did want to go back to the comment from Jacqueline, because the Zoom call was breaking up a little bit. Did you say that 5 of your cousins were tested positive and 3 of them passed away? That had to be devastating.
Yeah, it was. And I shared it only because all of us on this phone call have been fighting these inequities for decades. But these things hit very close to home. And my family, extended family, live in New York and in Florida. And it's been difficult to mourn and to also get up and keep fighting for our families here in California.
Yes, you can definitely post it. We're going to.
Well, it looks like we lost the Zoom call for a second there. But for those of you who are joining us online, I do want to point out that we're taking 2.5-minute commercial breaks. And so once we get close to coming back on television, we do have to jump in and cut the conversations short. We're not trying to be rude, but we do have to cater to the TV audience as well. So we have 1 minute. Leanne, did you want to jump in here?
Yeah, I think, Lara, you had an interesting point about trust, which is such an important aspect here. There are so many Latinos who don't trust the government, don't trust, what you tell them, for fear of, in many cases, those who are here undocumented, they fear being deported. I mean, you had an encounter briefly.
Yeah, it's with a construction worker near where I live. And I'll save the story for when we're on TV if we have the time. But it was unfortunate because people feel like they're trapped and they have to make a decision between finances and their own health when they're providing for their families or trying to, and so many have lost money. We're back in 10 seconds, so I'll stop it right here, and then we'll come back on TV in just a moment.
No, bueno, ahorita la dueña pues dice que no hay problema, que va a esperar a que...
Porque dijeron que
Well,
primero
we are
no.
in the same,
My biggest concern is people who do the worst job or the more difficult job in this country, and it's always affecting us. Always the low position is who affecting the most, and especially in this situation, because we are really vulnerable.
Muy desesperantemente todo eso.
Desperate indeed. People of color are really bearing the brunt of this pandemic when you talk about financial impact. According to a new AP poll, 61% of Latinos say they've experienced some kind of household income loss, compared with 46% of Americans overall. 37% of Latinos say they've been unable to pay at least one bill as a result of this coronavirus outbreak, while only 17% of white Americans say the same.
So let's go to ABC 7 News reporter Luz Peña live at the social desk, and then we'll address some questions to Congressman Joaquin Castro.
Leanna, Larry, we are getting lots of questions. Our essential workers are the ones on the front lines of this pandemic. Recently, Senate Minority Leader Charles Schumer proposed a hazard pay for essential workers. What is being done to help farm workers, sanitation workers, and specifically undocumented immigrants who are living and working in the shadows?
So that's a great question for Congressman Castro. Let's talk about hazard pay. I know that you introduced, one of the questions is that you introduced last month some kind of compensation pay for those on the front lines. In fact, Senator Mitt Romney, a Republican, also presented his own plan. You know, what's different from his plan? What's different from your plan? And how much compensation are we talking about?
Well, I guess the first thing is that for the Latino community, as for all Americans, but I think most especially for Latinos, this has been both a public health emergency and a financial emergency. And the survey numbers that you just quoted are exactly right. You have a significant percentage of folks in the Latino community who haven't been able to pay their bills and also who have lost out financially during this time. In many states, including my home state of Texas, for example, you also have many people who for weeks, if not longer, could not access unemployment benefits because of state workforce systems that were not designed to basically distribute money very quickly. And so on the economic end, it's been very, very difficult. And you have these workers in the meantime, while all of this is going on in their lives, who are essential workers, farm workers, sanitation workers, grocery store workers, healthcare workers. Some of those workers are undocumented. And undocumented workers, for example, even though they're paying taxes with what are called individual tax identification numbers, are receiving no financial assistance at all. And there's a graver injustice than that. They're not only are they not receiving financial assistance, even if they're married to a U.S. citizen and file their taxes jointly and have U.S. citizen children, the whole family is getting no assistance at all. And so many of us have been working with Speaker Pelosi, who of course represents San Francisco, to make sure that that injustice is corrected in the next round in what is being called CARES 2.0. And many of us also believe the proposals are a little bit different, but the core principle is the same, that if you're somebody who's been going out there, a grocery store worker, a farm worker, those meat packing plant workers, many of whom are now infected with the coronavirus, if you've been risking your health every day and going to work, that you should get some kind of hazard pay from your government or your company or both. And we're going to continue to push that very hard.
Let me bring it back to the Bay Area specifically and bring in David Campos, the County of Santa Clara Deputy Executive, because Governor Newsom has planned $125 million for undocumented workers, David. But I talked, and I mentioned this briefly in the break, I was talking to a construction worker today who's a friend of mine, and he said, you know, a lot of my friends and family members, they are happy to hear that the money may be coming, but many of them are scared because they're undocumented. They don't want to give an address to anybody associated with the government because they fear that they're going to be deported. Whatever the state says, they just don't believe it. And so that's a really difficult barrier to overcome.
It is, and let me say this, that I'm very fortunate to work in a county where the Latino community has a great deal of power and is a priority. I can tell you that from the very beginning of this pandemic, Dr. Cody, the public health officer, Jeff Smith, the chief executive, we were looking to see what impact this was having on the Latino community. And we actually approached our strategy in terms of education, media, from the perspective that Latinos would be disproportionately impacted. Our campaign to educate is not only in different languages, but actually it focuses on the fact that many Latinos don't have the luxury of sheltering in place. They actually have to go to work. I also had this conversation with Supervisor Hillary Ronen because, as you know, I represented the mission for 8 years. And the difference between San Francisco and Santa Clara is that in many respects, Santa Clara, San Francisco, Latinos actually have a greater presence and actually can flex more influence. And it is because of that, that from talking with Supervisor Ronen, it was important for Santa Clara to take the lead in educating not only our residents, but actually using the media throughout the Bay Area, because we knew that when we did 100 PSAs in Spanish about, you know, what it means to be an essential worker and how you can protect yourself, that our message not only would help Latinos in Santa Clara, but actually in San Francisco, in the entire Bay Area. But I think that it is a lack of power that has gotten this community to where it is. And it's going to take this community working with other communities. You know, you had a series talking about the African-American community. The African-American community, the Asian American community, the Latinx community, we need to be partners in addressing the inequities. And in Santa Clara, we are prioritizing those communities, not only in terms of health, but also in other areas when it comes to housing, when it comes to basic services. our board of supervisors is very committed to doing more for those communities because, you know, the federal government has not been helping the Latino community. In fact, to the extent that they have done anything, it's actually targeted the Latino community. And that's a fundamental problem that has to be addressed.
Quick follow-up here, David, because people who are not familiar with your background may not know that you came to this country as an undocumented immigrant and worked your way up, and I believe Harvard educated, and now obviously, you know, are representing, well, you were in the Mission and now in the South Bay. But speaking from your own personal background, what would you tell those who are fearful at this time to apply for that $125 million, a portion of it from the state of California?
Well, I think it takes having people in positions of power that understand these communities. I can see Congressman Castro. He and I went to law school together. I think we're a couple of years apart. And it's important to have the perspective of someone, in this case, that was undocumented. I can tell you that it's not enough to simply have the program in place. You actually have to figure out how you can communicate to people because people are afraid. And that's one thing that the county has done in Santa Clara. We have actually partnered with this community for years. This is not just a last minute thing. We had a campaign to protect immigrants. And so there's a lot of trust. But we also know that you have to understand the challenges. So let's take the issue of testing. And I had this conversation with our public health officer. It's not enough to provide a test and say Latinos should come and get tested, because we know from talking to some of them that if you are the breadwinner in your family and you get tested and are tested positive, that you are terrified that that means you're going to be quarantined and that you're not going to be able to provide for your family. So you have to not only provide the testing, you have to provide a means of helping that individual in the family financially. In San Francisco, Supervisor Ronan has a program that does that. I know that Supervisor Chavez in Santa Clara County is working with the philanthropic community to provide services and assistance to those families. And you have to understand that experience to really know how government at the local level should respond.
Well, what you're saying echoes what Leanne Melendez said at the top of the show with her report, indicating that people, as much as they may fear the virus, they fear not having a job or a paycheck even more. We're going to take a break now, but we will continue again online. You're part of this ABC7 Listens Town Hall as well. Go to Facebook or YouTube to weigh in and interact in today's virtual town hall.
Hey, how you doing? It's Chuy Gomez. I just want to wish everybody a safe stay at home, because we need you to stay at home. In order to be safe, you need to stay at home. And if you can translate this to your relatives that do not speak English, because a lot of the messages aren't getting out to our folks that don't speak English. So please tell your folks that don't hablo English what's going on. Tell them to stay at home. Tell them to cover their face. And let's be safe together.
Leanne, some thoughts here at this point? Because, you know, we're halfway in.
I know.
I can't believe that we're 28 minutes into the show.
I got to talk about the testing in the Mission. Okay, I got questions.
Okay, excellent. Yeah,
yes.
We'll get to the testing. Yeah, we're still live. Everybody's comments are so great, but if I could just say one thing to the panelists, less is more in this, because I don't want to spend most of the half hour with you listening to somebody else and then feeling like, oh, wow, I only got to speak a little bit. So just so we can all work together here.
Drinking tea.
Yeah, we'll just we'll go a little bit quicker on
Larry
something.
and
Could I ask all of you, each one of you, what have you been doing to shelter in place? I know that the congressman came back after March or during the March break, and you've been spending time with your family, your kids. Tell us about that.
Yeah, I just went to I've been back in San Antonio since about March 13th or 14th. I did go back to DC about 2 weeks ago or so when we voted on this last piece of legislation. And, it's still up in the air when the House of Representatives will go back for a full week to DC.
Okay, could we ask the other ones quickly? We have 1 minute. What they've been doing at home?
I've been working at the Emergency Operations Center, so haven't done that, but my husband is at home.
Okay.
The California Healthcare Foundation has been working remotely and really just trying to figure out how best to support the nonprofits that are responding directly, Jacqueline's organization being one of them, but also just really trying to make sure that the delivery system is being as responsive to individuals as possible. The ACA has been very successful in California. We should not lose sight of that as an important aspect of what we need to continue to do, which is to make sure everybody in this country is covered. The states that have disproportionate morbidity and mortality from this virus
Sandra,
chose not to expand.
We got to stop right there, Sandra.
Yeah.
Sorry.
Love to hear more, Sandra.
You're watching Race and Coronavirus, a Bay Area conversation.
Here in the state of California, for the population between 18 and 49 years of age, sort of prime working age, Latinos are about 44% of that population, but about half of the cases reported for that age group and 2/3 of the deaths reported for that age group statewide. Nationally, Latinos report that about half of them have either lost a job or suffered a pay cut as compared to about 1/3 of all other Americans. And because the Latino population has such a large share of undocumented Californians who have been left out of the federal stimulus package and cannot access unemployment insurance, these economic impacts are rippling through even more strongly in California's Latino population.
The numbers are staggering. Let's go to Luz Pena right now at the social desk. Hi, Luz.
Hey, Larry and Leanne, we're getting some exceptional questions from our audience here on Facebook and on Instagram. But before we toss it back to our panel, I want to highlight the excellent work a Latina doctor is doing right here in our community.
Her name is Karina Marquez.
I'm an assistant professor at UCSF, and I'm an infectious disease doctor here at San Francisco General Hospital.
But to her family, she's simply Karina, la hija, or daughter of a Mexican house painter and an American waitress, the first in her family to go to college. She graduated from Harvard University with honors, and 19 years later, she's giving back to her community during this pandemic.
You know, it's one of the reasons that I went into medicine, to be able to help my community.
In a city where 25% of COVID-19 cases are among Latinos, this fight is way too personal, taking her back to her own childhood when her family struggled.
It's heartbreaking, to be honest. I think about my family. I think about my own experiences not having health insurance. I think about my family in Mexico.
When internal data showed that 83% of coronavirus patients at Zuckerberg San Francisco General Hospital were Latinos, Karina Marquez answered the call and led one of 3 outdoor testing sites in the Mission District, the zip code with the highest number of COVID-19 cases in this city. This pandemic took her back to her time in Uganda and Kenya, when she was part of a team on the front lines of the HIV epidemic.
The vast health disparities that we see in HIV and in tuberculosis, we're also seeing in COVID-19. And I think that this virus, like many other viruses, exploits these underlying inequities that are already existing.
And a couple years ago, she gained a new title, Mom, that ironically brought her to this park.
This is the park that my son plays at.
Where, unbeknownst to her and the entire world, she would end up in her scrubs and a face shield.
We were so proud to be able to test 4,100 people at all the test sites. And I think we probably got about 1,000 people or more at this test site alone.
Growing up, Karina, like many kids, always wanted to have superpowers. And this pandemic has shown her that she's always had it within her, speaking Spanish.
The communication is so important, and if it can be done in people's language, then it makes all the difference.
Does your dad tell you now, te lo dije?
Yes. Yes.
Which translates to,
I told you so,
a superpower she's now passing on to the next generation.
Y el español es nuestro superpoder. When I spoke to Karina Marquez, there was something that stuck out. She said the reason why so many people got tested in the Mission was simply because they trusted us. That word trust is directly linked to the fact that many in her team spoke Espanol, which leads right into this question that we're getting from our viewers. How do we continue testing immigrant families in a way that is not stigmatizing and still culturally respectful? This would be a great question for Sandra Hernandez.
That's right. So, Dr. Hernandez, if you heard the question, how do we convince people to undergo testing, Latinos who don't necessarily trust the system, the health system? How do we convince them to do so?
Well, I would say a couple things. First of all, I think if you think about the basic values that really so represent Latinos, what people need to do to protect their families, people will do. And I think this is a question of really making sure that we make testing comprehensive in nature, that we explain it, and that we're providing all of these services that people need to be able to safely isolate if they in fact get tested positive. Not everybody has the living conditions to be able to do that, but the motivation to do that, to protect their family, to protect their coworkers, to protect the people they live with. If they understand that this is something that can be transmitted and would be transmitted without isolation, they will go into isolation and do it, whether they do it at home or they do it elsewhere. The onus is on us and on the public health system and on the social service system and on our community response system, really, to make sure that whatever support that individual needs, including economic support, because if you're going to leave the workforce for 2 weeks, or whatever the period of time is until you have negative tests and can freely circulate back in community, we have to make sure that that family isn't punished by a lack of income, and that that individual isn't punished because of that. And I think if we do that in a very thoughtful way and wrap around those services with, again, a comprehensive array of services, the very vast majority of people in our community will do the right thing.
Dr. Hernandez, I just want to,
thank
you. I want to ask you about the testing that was so important in the mission.
Yes.
The results were clear. 2% of the people who were tested, 2% were positive of all the people who were tested, 3,000. I assure you that when we heard that number here in the newsroom, everybody thought it was low. But in fact, it's not low because we stayed at home. It should have been much lower than that. And let me ask you this. If I live in Noe Valley, if I live in the Marina, Pacific Heights, what does that 2% mean to me?
Yeah, look, so these are numbers that we throw around. I think the point here, the most important point by far and away, is that Latino workers are essential workers. If you look at the population that tested positive in that sample, which was one zip code in the Mission District, they were mostly men. That is also true of the demographic more broadly in terms of the epidemiology of this virus. They're men that are working aged. And it is a very dense neighborhood. People live in very dense situations, largely because housing is ridiculously unaffordable in the city. And the housing crisis is very much a contributing factor to that. So 2% in some ways, you might say, well, is that high or is that low? The point of the matter is that we need to be able to do more safe community-based testing to be able to understand the epidemiology. We need to know who's at risk. And most importantly of all, we need to educate community in ways that they can understand how the virus is transmitted, how it's not. The fact that this virus has a superpower, which is the ability to transmit the virus without anybody ever having any symptoms, makes it a very challenging virus to contain.
Could I go on? Sorry, go ahead, finish.
No, the only other thing I was going to say about testing is really about stigma. If it's a situation where we take people out of the workforce and do things that are involuntary, and this becomes a stigmatized issue, we will have a massive problem trying to control this virus in the Latino community and in the broader community. And that really is the imperative, to make it safe, to make people understand how to do it, and to support people to isolate and quarantine when that's indicated.
I want to expand this conversation a little bit, and I want to ask Congressman Castro about the detention centers. And I know that I think yesterday we lost one person. You have called it a tinderbox waiting to ignite because of the virus. You're not saying that we should release everyone, but that they should at least be released and get due process.
Yeah, well, I'm saying that for many of the people that are in detention centers now, just a few years ago under the prior presidential administration, those people would not be in detention centers. They would be at home with relatives. And so they wouldn't be in danger right now. So unless ICE can go to court and prove that somebody is imminently dangerous, then they should do everything they can, given the public health emergency that's going on inside detention centers. They should try to release folks to relatives, and they'll still be able to set court dates for them and have them come back for their court hearings. But we've seen across detention centers, this thing, in some of them, spreading like wildfire. There are certain enclosed areas. We saw it on cruise ships, on the naval ship. We see it in nursing homes, in prisons, and in detention centers, that this virus spreads very quickly. And you're starting to see from that the result of deaths.
But I would just say it's not just the detainees. All the employees that work in these places are also at risk, as are their families and their communities. And many of these detention centers are in rural areas where we have very inadequate acute care capability. So it is a public health hotbox for detainees and workers alike, anywhere where you have a lot of congregation of people.
And if I may say, for Santa Clara County, we are a county where 40% of the population in Santa Clara County is foreign born. And we actually have sued the Trump administration probably more than any other jurisdiction, because what they're doing with the immigrant population is really unconscionable. And the other thing that I want to note here is that we believe, and our public health officers have said this, that we have to be very thoughtful about reopening the economy. We need to make sure that we have enough testing, that we have enough contact tracing before we do that. And one of the reasons that's important is that if we do it too quickly without having those measures in place, one community that's going to disproportionately get hurt is the Latinx community. Because if the economy opens up without those tools, it will be a lot of those Latinx, African-American workers that will be harmed. And so we have a responsibility to make sure that we protect those workers by doing everything we do from a public health standpoint to make sure that we have what it takes to identify who is positive and to then trace their contacts so that those individuals can also be taken care of.
Yeah, we got to stop right here for the moment because we have to take a break, but we'll expand on a number of those topics when we come back, and we want you to join in on the conversation. Go to Facebook to weigh in and interact with us and our guests and Luz Pena on our virtual town hall.
Together, we will come back from this a stronger and more vibrant community.
Y hay que seguir la batalla unidos contra esta pandemia. Juntos saldremos de esto más fuertes.
Stay safe and healthy. Sus amigos, los Tigres del Norte.
Okay, we continue the conversation here off camera.
I got a question actually for Dr. Hernandez, if you don't mind me jumping in.
No, please do.
So I don't know, Doctor, if you had a chance to look at the email, but there's some numbers from the California Department of Public Health that came out, and it's kind of puzzling to me, but basically what it said was there were about 20,000 cases of the virus in the Latino community. Whites were about 10,000. Deaths were pretty much even, 819 Latino, 794 among Caucasians. So essentially, twice as many Hispanics are getting the disease, but the death rate is about the same. How do you explain that? Is it because younger people in the Latino community are getting this and they're surviving, or what's going on with that?
Well, there's a couple things. First of all, you have to be very careful about case rates because case rates are only telling you about who's getting tested and who isn't.
Okay.
We still don't have point of service, point of care testing everywhere in the state, let alone any place in the country. And until we have that capability, it's very hard, epidemiologically speaking, to really understand the difference between case rates and mortality rates. That being said, the Latino community is generally speaking a younger community. And that in and of itself is protective. It's also why that population is circulating and working, because it is a younger population to be able to do that. And because people are heeding the over the age of 65 and the vulnerabilities of older age. So I think the epidemiology is incomplete until we have this affordable point of care testing, both in hospitals and in clinics, but elsewhere as well. And that is, when we have that, we'll have a better understanding of the epidemiology of the virus itself.
Okay, we only have a few seconds left, so I'll have to stop it there. But I do appreciate it. The numbers are what they are, but they may not reflect reality, in essence, is what the doctor is saying.
We all have seen the data and know that Latinos and all communities of color have been the ones mostly affected by this pandemic, from job loss to deaths to lack of financial support. However, within our own families and for generations, we have overcome so much from our countries of origin as immigrants, as dreamers, as entrepreneurs. So I'm absolutely positive that we will overcome this as well. But I do want to encourage people in positions of privilege, including Latinos, to make it a priority to support the recovery of our community at a really accelerated rate for America's sake. Latinos are the backbone of the American economy, from workforce to consumption rate to GDP growth. And America can only thrive when Latinos succeed.
Let's go back to ABC 7 News reporter Luz Pena, who's live at the social desk. Luz?
Larry, we're getting great feedback from our audience. I'm here checking Facebook, and I have Maria Hernandez. She said, we're all in the same boat, but we're not all on the same situation. Also, Joanna is here saying, I totally agree with you. It's not just about getting tested. There is fear in our community. And then we have Julio Lara, who says, we need commitment by politicians that when our people go back to work, they will be protected. And then we have David, who is commenting in Spanish, and he's saying, tenemos que trabajar, queremos trabajar, abre la economía, termine la cuarentena. So many of these people that I'm here listening to their comments and reading everything that people are saying here, they want to know what's going to happen when these Latinos are going to go back to work, the undocumented community, are they going to be protected?
I think that's a great question for Congressman Castro. When people go back to work, and we will, how will they be protected? What are you doing in Congress to see that through?
Well, there is a role for the federal government to play. There's also a role for the state governments and the local governments to play in making sure that there are regulations, safety protocols in place so that when people do go back to work, they're provided the protective gear they need, for example. The workplaces are cleaned and they're safe for folks to work, that there's social distance between co-workers. But for the federal government in particular, let me take one workplace where, as an example, where the coronavirus has spread very quickly, and that's the meatpacking plants. The federal government needs to establish mandates on worker safety protocols in those workplaces that are especially vulnerable to quick infection, and where the workers there, really, many of them are without a lot of economic or political power to challenge their employers. And so the federal government has a big role to play in making sure that that happens. I also hope that the state government and the local government will step up and do the same thing.
I have a question for Jacqueline Martinez. Welcome back from the Latino Community Foundation. I want to ask you about the money that is being given to undocumented workers. About 150,000 of them will get a check for $500 each, or $1,000 per household. Granted, that's not that much, but they have to apply here. So how do you reach out to them, and how do you convince them to, apply, give their name, their address, and make sure that they get this money?
So, Leanne, I'll answer that question. I want to come back to a point that Representative Castro just mentioned right now. So this is why the nonprofit sector is so important. Latino-led organizations, there's over 400 of them in the state of California. Before this virus hit, they were under-resourced because less than 1.1% of all philanthropic dollars are invested in them. We need to proactively invest in them so that they can actually be the ones to walk people through that process, to create pathways for them to navigate the application. David mentioned this in the mission. Latino community organizations were critical for just the testing. It's going to be the same true in terms of how that money gets distributed. So we have been in conversations with the governor's office, making sure that the organizations that are selected are indeed trusted organizations led by Latinos and employing Latinos that are actually people that would understand the condition that people are living in right now. And Leanne, I want to come back to a point that was raised just now. Maria, the woman that Luz just mentioned, said that we're not all in the same boat. I also heard someone say we're in the same storm, but we're not in the same boat. And the storm right now is shaking all of us up. The reality is that there are going to be sectors like retail, restaurants, and service industries where Latinos make up the predominantly employer base, the labor, will never go back to being what they used to be. And so we as a nation and as a state have to start thinking about universal income for these families. We have to start thinking about making employment accessible to all workers. Congressman Castro already said this. In California, $3 billion are paid by undocumented workers. And so if they are going to be out of jobs for long periods of time, they should be applying for these benefits. And then when we think about places like the Inland Empire, where jobs are going to be automated as a result, I mean, the meatpacking industry is another example that may accelerate automation of jobs. How are we going to prepare the workforce, the Latino workforce, to be ready to enter what will be a completely new normal for our country and our state?
Yeah. If I may say something about the undocumented community, because I think that's a very, very critical.
We're short on time.
They pay more taxes than Donald Trump, but the federal government is not helping them. We need the philanthropic community to come in and partner with local governments, state governments to create funds to help those families that are actually working and contributing to our country.
All right.
Thank you.
To take action, log on to our website, abc7news.com/takeaction. There are links to resources on race, coronaviruses, and other issues that you may be dealing with. And we'll be right back.
You know, it's very vital for all of us as a Latino community to understand that we're currently being disproportionately affected by COVID-19 all across the Bay Area. Studies show that right here in San Francisco, we account for 15% of the population, but 25% of COVID-19 cases.
But together, we will get through this. I'd like to thank ABC7 for hosting this platform, this town hall, and I urge you, please take care of yourself and one another. Que Dios los bendiga, los cuide. God bless.
All right, so we've got another 2.5-minute break here as we wrap up the program. And
I have a question, Larry.
Well, go ahead.
As a Latina, we often say that, you know, we are unidos, pero realmente no lo somos. We are united, but sometimes we really aren't because some of us are Puerto Rican, Cuban, Mexican. Do you think that that gets in the way of this?
Actually, the producer's talking to me while you were talking, so I didn't hear the last part of your question. Say it one more time. I'm sorry.
I'm asking the panelists that if any of them feel that this gets in the way, the fact that we come from different countries and sometimes we think we are united, but really we are not.
I think for the people that... Go ahead.
Well, no, I was going to say, you know, of course, I chair the Congressional Hispanic Caucus, and we have 38 members of Congress that come from many different backgrounds, Latino backgrounds, and everybody's worked pretty well together on the issues that confront different communities. For example, we've been dealing with the situation in Puerto Rico where when you think about the financial devastation, Puerto Ricans didn't get their checks. Their checks were held up for weeks past when they should have been. And so all of us rallied to try to resolve that situation with the Treasury. But you know, so far, everybody's worked together pretty well.
I mean, the people who discriminate against Latinos discriminate against all of us, and they assume the same things about all of us, irrespective of which country we're connected to.
Well, everybody tends to get reduced to being Mexican, pretty much.
Exactly. Right.
You're Mexican.
Right.
What is the biggest challenge that you're facing? We have 30 seconds. If somebody could answer that right now in 20 seconds or less.
Well, if I could just say, you know, the next public health tool we absolutely need to get in place is contact tracing.
Absolutely.
And that is gonna have to be done in a culturally appropriate way, using appropriate language, training people from within the community to be able to do that. Trust will never be more important than it will be in contact tracing. And if we don't do that well, we'll all be back into shelter in place again soon.
Thank you, Doctor.
From the community.
Y quizás now the Latinos
we are in this same
bueno, ahorita la dueña pues porque dijeron que primero me habían dicho que me iban a inyectar para dormirme cuando me iban a entubar y ya yo pensé lo peor. Pensé que me iba a morir.
And that's a reality.
You could see the fear right there. I want to thank our panel of experts for taking time out of their busy schedules today to talk with us and with you as well about race and the coronavirus. This is really only the start of a very important conversation that unfortunately will probably go on for months and months and months. But again, to all of you, thank you for your time. It's certainly a conversation that's worth having. Let's get to our final thoughts. Luz, can you start us off?
Yeah, well, hearing from you online during this town hall has really amplified the importance of highlighting the inequities and challenges that our community is facing during this pandemic. But let's not forget that this was happening even before COVID-19. As a Latina who was born in Barranquilla, Colombia, I feel the pain and the underlying concerns of our community when they're afraid of walking outside, when the invisible virus is not just COVID-19, but also inequality. I'm proud to work at a station where our voices matter and our diversity is celebrated. Unidos somos más fuertes y para adelante, nuestra gente.
Well done. For me, this is my final. The coronavirus has exposed our deep inequities and this country, and we hope to emerge even stronger than ever from this. And I'm going to quote one of my favorite authors, Sandra Cisneros. She says, "I've put up with too much for too long, and now I'm just too intelligent, too powerful, too beautiful, too sure of who I am, finally, to deserve anything less."
I love that quote.
That's what I have.
All right. Just to keep it real here, as a middle-aged white guy, I'm the least qualified person on this show to truly understand the challenges of Latinos right now. I can read the numbers and I see the frustration and I hear everybody, but it's really so different when you happen to be the person in the trap of having to decide between risking your health over here or putting food on the table for your family. As many differences as we have, white, black, person of color, we have to remember we're all human. This virus doesn't care about your ethnicity. It's an equal opportunity killer. We got to find ways to help each other, not keep others down.